This is treatment of the lower extremity using myofascial release in a long lever system. One can do this with either both legs or one leg individually. The purpose of this can be to release fascia in the lower leg, in the thigh, or in the pelvis, or even up into the diaphragm. The difference is obviously the focus of the treating physician. So one would contact the lower extremity, usually just above the ankle, contacting skin, but focusing deeper onto the fascia. And in this case, I'm going to look at the hip in particular. So I'm going to apply a little bit of axial traction on the hip, and I'm going to look for a position of ease. And she actually has more motion moving into a little bit of abduction on her left leg. I'm then going to look at internal rotation and external rotation of the femur. And again, she prefers a little bit of external rotation on her left femur. I'm now going to check the right lower extremity, again with my focus at the hip. I have some axial traction. I'm testing adduction and abduction. Again, she has more freedom of motion in abduction. Now testing internal rotation, external rotation, again of the femur. A little bit more ease going into external rotation with that abduction. I then straighten my torso so that I am more erect and I am leaning with my body weight to affect this change rather than using bicep strength. And I am waiting for a release of the tension in those tissues. Then I'm going to go ahead and retest. And she had good motion in abduction, still has has some improvement in adduction. She liked external rotation, but she also has much freer internal rotation at this point. Checking the right leg, she had freedom in abduction, but she has much more freedom in adduction at this point. She liked external rotation and actually has much freer internal rotation with the conclusion of the treatment.